thank you all for staying behind for lunch and staying to support this evening's presentation. I'm sure we've had a good day today. No, not that good?
Yes, very good day.
Was that bad?
That was a lovely day.
Oh, it's going up there. Okay, good. So today, this evening, we're going to carry on with our health program. A different area which is more specialized than the one we had before, which is cardiovascular. I'm pleased to present to you our speaker this afternoon is Dr. Paul, or Elder Paul from Chelmsford Church. Many of you may have seen him before. Some of you may not have known he was a doctor. He's so busy up front doing other stuff in the music department. You just don't know what people do in their spare time. It's probably not your spare time, is it? Full-time. Yeah, it's full-time job, definitely a full-time job. So I'm going to start with a word of prayer. If I can ask us to stand. Our Father who art in heaven, we thank you. I can't thank you enough for what you do for us and for where we are and who we are and what we have received and are about to receive. We pray, Lord, that you will open our understanding and open our minds to a way of maybe better living and how we can keep ourselves the way you would like us to keep us. Pray we be with Dr. Paul at this time as he presents the health message. You will guide what he has to say. Also is my prayer in Jesus' name. Amen. Dr. Paul?
Thank you, Elder, and thank you, Church, and all the elders for this privilege and opportunity for me to make this presentation to you. Actually, I was a bit confused as to what I should speak here because I was not sure who will be here. But however, because it's also a Sabbath, I'm conscious that some of you might not be comfortable with certain things. I'll just keep it very brief, and I'm not sure, in case I miss out anything, you can ask me, and perhaps if it is appropriate to answer today or in the public, I will do so, but otherwise I'm happy to be contacted any other time apart from the Sabbath, in case you're not comfortable to do so. But I thought the public might be there, so I came with an open mind, but looks like, I just asked the elders, said that there will be only Adventists here. So probably I should begin with a verse in the Bible, 3 John 2, it says, "Beloved, I wish above all things that thou mayest prosper and be in good health." Okay, the Adventist philosophy is that it not only promotes optimum or good health to its own members, but also to our neighbors, because as you know, we ought to love our neighbors, and we need to care for our neighbors, which means people in the community. So apart from the professional activities that we do, most of us, I think, are involved in most of us are possibly involved, especially immigrants. They are all involved in the health field, but we also have to show the love of God and care for the others' health in all ways possible. So I've come here perhaps to this is the topic that was given by Elder about high blood pressure and cholesterol, taking care of your heart. So perhaps if you think it is inappropriate, I will just skip and probably move on. And I won't go into the depths because children are all here, and I don't want to go into the scientific aspects of these things, but simple ways I can explain. And what I'm going to say might not be something new to you. It's just probably sometimes I'm just brushing up some of the things. And perhaps some of you seated here might have more knowledge than me too. So I'm open to learning from you all as well. Okay. So the topics for the hypertension or high blood pressure. High blood pressure or raised blood pressure is also called as hypertension. Hyper is excess, tension, as you know, is tension, all right, or a pressure. So high tension is hypertension. So the prevalence here in the United Kingdom, how do you diagnose it? At least, how do you find out? That's what it's not in the terms of it's not in terms of medical diagnosis, but in terms of ordinary layman, how you can diagnose it or understand it, and how high blood pressure is classified. I won't go into the details, but just say certain things and how it can manifest in us, and what are the risk factors, and we are going to prevent. I'm not going to talk about the treatment. Treatment, of course, is left to the secondary care or tertiary care, which means the hospital. But this is about the primary care, which is prevention. So that's where we all have to intervene at the level of primary care, which is prevention. So let's go to the prevalence. I want you to just remember, high blood pressure is highly prevalent. If I have to, I just put some information there, but just remember, high blood pressure is very highly prevalent. Already if you go out to the community, in the United Kingdom, there are 3 things that is very highly prevalent, or 3 things that causes maximum health damage to the community or to us. But not so to the Adventist, assuming we don't smoke. Number 1 is smoking. Number 2 is nutrition and diet. That's the second highest factor that affects the health of the people in the United Kingdom. And the third thing is high blood pressure. So today what we are talking is about the third most significant, important aspect that affects the health of the people here in the community. So 30% of the adults will have high blood pressure. How many? If there are 100 people, if you take in a group, 30% will have high blood pressure. And I also want to confess that I became a person with high blood pressure as well, and that's the reason I've come here to say that, why it affects people like us. Okay, I'm going to come to that in a minute. And out of the 30% who have high blood pressure, 15% will not receive any treatment. And I'll tell you why it is dangerous. I'll just come to the next aspect. Because of the high blood pressure, if you look, what's the population here in the United Kingdom? Any idea? Around UK? Yeah, around close to 70 million. 70 million. And about 5 million are just hidden in the community without even knowing that they are all hypertensives. I didn't know I was a hypertensive. Just on a routine examination, they called me and they checked, and I found out that, to my shock and surprise, that I'm having high blood pressure. And that, when I heard that I have high blood pressure, my blood pressure really went high. Okay. So that means 50% are not diagnosed or treated. And it is a silent killer. Suppose if I wouldn't have, I wouldn't have known that I do have high blood pressure, It can lead, as I said, it can lead to stroke, heart attack, other cardiovascular disease, and renal failure, kidney failure. I deal with day in and day out. My specialty is to deal with patients with a stroke in the eyes. So that is one of the subspecialty that I deal with is a stroke in the eye. And I'm so surprised every week. I do have around 50,000 patients in West Essex and East Hertfordshire. And I do have a long list of patients still waiting to see us. The wait list is more than 3 to 6 months. And I can't believe that many people every month and week and day are affected by the stroke. The stroke can happen, eye is just an extension of the brain. It can happen in the eye, brain, brainstem, and then it can happen in the heart, that is called as heart attack. It can happen in the lungs, and then it can happen to the extremities, periphery, and people will have gangrene and lose the toes. It can go to the kidney and affect the kidneys and then end with renal failure. So it's very dangerous. Okay, so I'll just move on. As I was just mentioning, how do we diagnose that we have high blood pressure or not? The normal blood pressure in an individual should be, there are 2 values. When you check the blood pressure, there are 2 values. The higher one is called as the systolic blood pressure, and the lower value is called as the diastolic blood pressure. And you might not know what, the reason I don't want to go into the details, what causes the systolic, what causes the diastolic, but just know the values. The values should be around 120 by 80 to 90. 80 is the ideal one, but it can be up until 92. So anything more, then of course it is graded as grade 1, grade 2. The higher it is, the higher the grade becomes. I'm not going to go into these numbers. Just know the normal, and if it is, and there is a caveat to this. As age progresses, the pressure increases. Now, why the blood pressure increases? Do you know anybody here knows why the blood pressure increases? Inflexible arteries, yes. That's one thing. Good. That's true. Just imagine, very simply, this is not a rocket science. Just imagine a tube. That is the blood vessel. The tube is the blood vessel. The pressure inside the tube can increase if there is more fluid. Isn't it? Does it make sense? More fluid, the pressure increases. Higher blood volume. Or the same volume is there in the fluid, the pipe constricts. The tube constricts, all right? Or it becomes narrow. Narrow, it can happen, as you said, with the plugs or narrowing. Or sometimes the pipe, the pressure gets more. If it expands, the pressure will be fine, isn't it? When the pressure expands. So, for example, if there are more people in this hall, we feel the pressure, but you increase the size of the hall, the pressure is relieved, isn't it? But the stiffening of the wall, as you were mentioning, inflexible wall, that can lead to raised pressures. So several factors contribute to all these things. More fluid there, narrowing, stiffening, and there are chemical causes, neurological causes, and various manifestations. I'm not going to go into those things, but all these things can cause. But however, when the pressure raises, for whatever reason, it is called hypertension or high blood pressure. Okay, it is called as it is kind of divided broadly into essential and then not non-essential, secondary. Secondary means there is a disease or there is a problem that is causing to that. Essential, it is unknown cause, but most of them are because of this essential hypertension. And let's see what exactly happens to us. As I said, I became a hypertensive, or I got high blood pressure. I didn't even know that I was having high blood pressure. So some of you might be seated thinking here, well, somebody is having high blood pressure. You know, sometimes you do not know unless you check it. Because that's how I was asymptomatic. You know, I do get patients who come and tell me that I developed this stroke. I said, did you have high blood pressure? No. Only when I went to the stroke and I went to the hospital, they checked the blood pressure and they found out my blood pressure was very high. So, you know, you might be thinking, you know, you're wasting your time and being here, but, you know, who knows, at least if one person is benefited here, I will be happy. Because you'll have to go and check your blood pressure today. Okay? I'm not trying to raise your blood pressure, by the way. Okay? But sometimes there could be some other symptoms that someone can ignore, like you can feel dizzy, there could be headache. As I said, I didn't have any symptoms, but when I was stressed at work and continuous work, I used to have headache in the back of my neck, Then I thought probably, you know, these computers or, you know, I'm operating on this microscope, so kind of bending leather for hours together, that's contributing this pain in the back of my neck, and I just used to shrug my shoulders and just move my neck and, you know, flex and hyperflex my neck, and I thought that is because of that. But because of the pressure of the blood vessels in the neck, it can cause headache, and especially those who develop stroke, they will have this severe, it's called as an occipital headache. This is the occipital headache, so it can happen. Neck tightness, fatigue, all these things are causes of high blood pressure. Sometimes you think, okay, we are not resting well or not eating well, but fatigue itself could be as a result of this. But as I said, elevated blood pressure is often found during the physical examination, like it happened in my case. But in a small number of patients, as I alluded to earlier, it can be discovered after a heart attack or a stroke or when somebody has a kidney problem. So just I wanted to say, and sometimes, sometimes you can feel some abnormal clicks and sounds you can hear sometimes, or sometimes routinely somebody might just find out and auscultate and then find out there's a heart murmur. Then they find out then it could be as a result of the blood spurting through a narrow arteries in the heart. So that can be one of the things. And those who have high blood pressure will have a very high BMI, body mass index. And the other thing is patients can have Cushingoid phase, which means they can have the swollen phases. Okay. If I'm swollen, that means my blood pressure is high. Swollen phases. That is also because what happens, it can cause renal impairment, kidney impairment, and fluid retention, and it can cause the face could be swollen. This is the most important aspect that I just want to kind of look into, especially for us, as we are looking for what are the risk factors and how can we avoid them. I just put smoking because I thought the public will be there, but pardon me for putting that if it is only members, so I hope nobody takes this as an offense, but that's the fact, all right? But smoking doesn't mean that sometimes we think we are Adventists, we don't smoke. We sometimes get caught in passive smoking, don't we? Especially in public. In the public, we got caught with the passive smoking too. So that is also kind of a secondary risk to us. And salt, high salt diet. That I think could be one of the factors. Sometimes there is a saying in my mother tongue that says, any food with a diet belongs to the bin. I do not know. So that thing has been ingrained in my mind, and whenever I eat some food without any salt, I think, oh, this belongs to the bin. So in order to avoid binning that, I put salt, and I used to eat. But that could have had an effect on me as well. Alcohol, of course, as I said, I thought the public will be there. Men are more affected. Men have higher risk of high blood pressure than women. I'm not sure why. I do have a theory, but if I say that in the church, people will be offended. That's a joke, anyway. Because those who give cannot have, isn't it? So then age. Of course, with increasing age, there can be higher association of the high blood pressure. And I'll tell why I should be having. One is the salt, the other one is lack of physical activity. People, sedentary workers are affected more than the manual. I am always sitting, from morning all the way. I sit and see my patients, sit and operate on my patients, sit and see my patients, sit and do every work, and I hardly moved. Earlier when I came to this country, I worked 14 years in our hospitals in India, where we had assistants who will go and call the patients even to the room. So even that bit, when I came to this country, and I was shocked that I have to go out of the office, I have to go to the waiting area, and I have to call the patients. I was thinking, where are the people who are supposed to be calling? Then I realized, it's not like in India. But then I realized how lazy we were. And, lack of physical activity. And after the day of work with all this mental stress, come home and you're so tired after traveling and work, you just come and relax and don't do anything. Just like couch potatoes, just sitting there. Lack of physical activity. High blood lipids, cholesterol, raised cholesterol can cause as well. Diabetes. If someone has a diabetes, there is a high incidence that they can develop high blood pressure. Overweight. As I said, the high BMI, overweight, increases the incidence for high blood pressure. And genetic. My grandfather had, my father had, and I'm having. And possibly I'm going to pass it to my son as well. I do not know. But genetic is a non-modifiable factors. The others are modifiable. All right? So if we have one thing I can't change is from whom I was born. But the other things are modifiable. Okay, this is the most important thing, How do we, this is the scientific recommendations to lower blood pressure. And if you follow 2 or more of these, and combine 2 or more of these, of the 7 recommendations, you can lower your blood pressure or prevent it. Number 1 is weight loss. The higher blood pressure is called as the higher reading is called as a systolic. You can reduce it by 5 to 20 millimeters every 10 kilograms you lose. So if you lose 10 kilograms, as I said, higher body mass index, it leads to high blood pressure. So when you reduce your blood pressure, the body weight, by 10 kilograms, every 10 kilograms, you can reduce it by in the range of 5 to 20 millimeters mercury. That's actually a quite significant amount, sorry. As I said, I just put it for the public. Know or limit the alcohol intake. I'm not going to go into the details for that because it's not applicable here. And the most important thing is, as far as we are concerned, is to reduce the sodium intake. Reduce the sodium intake, which is no more than, as I mentioned there, 2.5 grams of sodium or 6 grams of sodium chloride. Okay, that's a good question. Now, salt is available naturally in the food that we eat. We add salt as an additive for the taste, but sodium is present in the fruits, vegetables, in all the dietary supplements that diet that we take. But when we add salt, which is the purest form of salt is sodium chloride. When we add that, we add the required normal dose. Now, why this increases the high blood pressure is sodium, when it comes into the blood, whatever we eat get absorbed into the blood. Sodium, when it comes into the blood, it brings the heard about osmosis. It brings the water along with it, and therefore it expands the volume of the blood. And the blood vessel, when the volume increases, the pressure increases. And that is one of the mechanisms. The other mechanism is for the constriction and the dilatation, or constriction and expansion of the blood vessels. There is a pump in the muscle level called as a sodium-potassium pump. So when you have excess sodium, then this contraction also occurs, causing the strain. So sodium works in different mechanisms by which it increases the blood pressure. So did I answer your question? Okay. So reduce the salt intake. In fact, it is recommended that you don't need to have additional salt in your food at all, which is very, very difficult. I'm struggling. I'm telling you honestly. I'll rather...
Just to say as well, I think it does matter as well when you put the salt in the food, because often some people will cook with salt, whereas you have other people, they will add salt after the food is already cooked. And I think it's different inside your body, depending on if you cook with salt compared to, obviously, you still need to limit the amount you're going to use. But I think if you use it after you cook and then you put salt on top, in comparison to cooking with it, it's even worse.
I've seen some videos where they cut the meat and they take the salt and then do like that. Have you seen that one? Have you seen that? Sorry? They go to restaurants in London, they have this salt. I didn't want to tell the name, but you said it. So they just do this one. And at home also I've seen, I've been to one of our Adventist house, and they were just doing like that as well. So the salt from the hand just falls on this and then trickles onto the food there on that tray. If you eat vegetables, you don't need that salt. But salt is required only when you eat meat products. As long as you're a vegetarian, you will, of course, the problem that we have is last week I went to Wales I don't want to say anything because sometimes it's very dangerous to speak amongst Adventists because it's a very closed community. Sometimes I don't want to say anything wrong, but somebody had a heart attack and I went to see them. It could happen to me too. I'm not going kind of accusing or blaming anybody. Adventists also develop these things, and I'm wondering why. And, we don't want to eat meat. We don't want to eat meat, but what we do is we really, I went to a house and then I sort of, what? They've got chicken, they've got fish, they've got everything. But they said this is all fake. all fake. Fake fish, fake chicken and all these things. And I was wondering, if you don't want to eat, why do you want to eat that fake things? You might as well eat the real thing. Sorry?
I think that's the problem with today's society because there's such a range now for vegan, for vegetarian, for all of this. You end up with all of these almost artificial products where you're not actually going back to the basics, the raw products. You're no longer doing the raw version of things, raw veg, organic, all of that. Instead, you're going along with the way the culture is of the land, which is now creating all of these artificial versions. And if you then look what's inside of that, you should have stuck to your meat, you should have stuck to your chicken, you should have stuck because
I concur with you, sister. I really concur with you. Yeah, you might as well eat that. I was thinking, that means you still have not given up on the desire for the meat and fish and chicken and all those things because you want to, you still want to have the taste. You still want to have those things. And the salt and the spices and all those things were equally good. Yes.
Cassandra asked or made a statement about eating salt before you cook or after you cook. Does it make a difference?
Yes. There are, this is not, I have heard this in one of those cooking classes that if you add salt whilst cooking, it kind of penetrates the food better. But at the same time, it can be even dangerous, especially with oil and with high heat. When you do that, the chemical reaction can be toxic and even they can be carcinogenic. Okay, this is an anecdotal thing I'm just saying because this is what I heard, that especially with oil and high heat, if you put the salt and fry it or season it, it can be dangerous. But it will penetrate the meat or whatever we are cooking little more deeper. Whereas if you add more, if you do that before or during and then after, of course, that is dangerous. But if you add salt after, you won't get the same flavor as you did it whilst you were cooking. But you're asking, have I answered your question whether it's dangerous or not? It is dangerous, especially with the high heat, that if you're doing so, you'll have to do it with a very low heat, I believe, and then not with high oil. Because the chemical reactions can be, sometimes they can change into cancerous things. There is no RCTs or randomized controlled trials because you can't give to people to find out if they're going to get cancer or not. So that's the reason there's no way of testing these things on people. All right, okay. So the fourth thing is to take potassium. Now, as I said, there is this potassium, sodium, potassium pump. If sodium comes in, potassium will go out. If potassium comes in, sodium will go out. So they work contrary to each other. So whilst to help our hypertension or reduce the high blood pressure, we need to reduce the sodium and increase the potassium. Now, and as I said, I put the volumes there. It should be approximately 90 millimoles per day. And sorry. And sodium, as I said, should be 100. Potassium is around 90. Just remember the value. Both around 100, just around 100. Now, potassium, I want to tell where is you get this potassium. All right. I do not know whether I should say this inside the church or I'll go outside and say it and come back. Okay. One of the banana has a high content of potassium. all right? Whilst potassium, banana is good for that, but in diabetics, of course, you'll have to be very careful in diabetics. And also, kale has, and tea. That is, I said, should I go out or not? Tea also has high amount of potassium. Teas, drinking tea, not coffee tea, the tea. Tea has a high amount of potassium as well. But of course, I have not said it, you have not heard it from me here. Okay, you should not say somebody from Chelmsford Church came and told you drink tea. No. I'm just saying where there is potassium, but you don't have to choose it. But as I said, kale has, and there are other vegetables too, has potassium. But banana is something that you need to just keep in your mind, has high potassium.
Because some of us eat green bananas. Cooked. We cook it, boil it.
When you cook certain things than eating raw, what happens is the nutrient value diminishes.
Okay, thank you.
So, because, as I said, some of these things are water soluble too, and some of them are fat soluble. So sometimes when you cook it or steam it, it can, water soluble things can get, the nutrient value can diminish or reduce. At the same time, as I said, sodium should go out of the system. Not completely, sodium is required as well, but not excess. But you need to have more potassium as well as calcium and magnesium. Too much calcium also is not good for the heart. The heartbeat and the rhythm of the heart is maintained by calcium. All right, there is a channel, that calcium channel is very important even for blood pressure as well as for the heart. So, but too less calcium can affect the heart. And of course, calcium is also necessary for the bones and for the integrity of our skeletal system. But calcium is one of the very important things for the heart and also to the blood vessels. So calcium and magnesium supplement is necessary to reduce the blood pressure. And the next thing is smoking. I'm not going to talk about that. Saturated fat and cholesterol. I'll come to you, sister, in a minute. We were talking about the kind of food that we eat. We'll have to see the processed food. What you are mentioning is about the processed food. Processed food has high amount of saturated fat and cholesterol. All these things are not good because these cholesterol can get deposited in the blood vessel and can cause stiffening, or the deposits can cause narrowing of the blood vessels. And so we'll have to reduce fat and cholesterol, saturated fat rather. I'll say the 7 and then I'll come to you. Is that okay? The next thing is aerobic exercises for 30 minutes. I've got another slide in case if there is any details that you require. I have got another slide, but just to tell you that at least 30 minutes of exercise for 5 days a week is good. At least it can reduce the pressure by around 4 to 9 millimeters mercury. You tell this one and I'll tell you something else more.
I don't know if you can answer this question, but I'm just going to ask. It's regarding salt still. So I was doing some research about people that can drink, 2 to 3 liters of water a day, but a lot of this water they're passing, it's not actually entering the cells inside their body. So research into how you can get these cells to remain in the body. And what I found from research was there is recommended to put a tiny crystal of Celtic sea salt on your tongue before you then consume water to try to make sure that that then enters your cells. But I wanted to know, if, you know, how does that work? Bear in mind that we're looking at salt right now, and we're looking at decreasing the amount of sodium, increasing the amount of potassium. How does that, or would that, then have an effect on the body in a positive way in terms of our cells being able to absorb that much water?
Okay. Now, if you look at the cell, just imagine its cell to be a kind of like a box. There is this nucleus, there is this cytoplasm, which is the fluid around that, as well as the mitochondria, which is the battery of the cell. And on the sides of the membrane, which is the wall, as it were, has these channels that will allow the potassium to come in. That there is something called as an intracellular milieu. That means the intracellular environment. Has to be maintained for the integrity of the cell, for the cell to be a cell. All right. Now the water level should be appropriate, calcium, potassium, sodium, everything. Now the body maintains this milieu, which means the cellular environment. If it becomes excess, the channels will open and it will send it out. Now, when you take excess salt, what will happen? Excess salt will enter into the cell. And when the cell comes in, when the salt comes in, it drags the water along. Suppose you put some salt. I don't want you to experience this, but you know this. If you eat anything salty, immediately you feel thirst and you want to drink water. Why? Because the intracellular milieu is affected, and therefore you crave for water to draw the water into the cell to maintain that. So when the cell is filled with excess water as a result of excess sodium, what happens is the cell swells up. Now you've seen sometimes our feet swells up, and earlier I was telling in high blood pressure the face will be swollen with as I said in one of I think the third slide, as I said it, like a Cushingoid syndrome or a swollen face. The swollen face is because of the excess fluid. And if you see the foot, when there is edema, they call it, fluid, that is because of excess fluid comes in. Due to several reasons, but one of the reasons is high salt intake. So when you have more salt, water is retained in the body and you don't pass it out. So when water is retained, your weight increases. Okay? And not only that, when the water is retained, the blood volume increases because blood has significant amount of water. All right? The fluid component of the blood. The plasma has a lot of water. So when there's more salt, it will retain the water into the blood, which means it will expand the blood vessel. And that's the reason the pressure increases. I don't know whether I've made it clear. So as I said, the 7 things that we need to do is weight loss, no or limit alcohol intake, reduce the sodium intake, increase potassium intake, but not more than 90, because more than that it will affect the rhythm of the heart. It can even stop the heart if it is very excess, especially in kidney disease, where potassium is not excreted. The high potassium levels can cause heart blocks. All right, so dangerous it is. And make sure you have enough adequate calcium and magnesium too. And of course, you have to reduce saturated fat and cholesterol, engage in aerobic exercises. This regarding exercises, just want to make a point. You can do, in addition to these aerobic exercises, it is also, you heard about cardio exercises. So that if you can engage in 2 days a week, and also muscle strengthening or muscle resistance exercises, probably 2 days a week. In addition to that, to these, it'll be even more beneficial. just as a passing mention, I just wanted to mention.
As a gauge for the potassium intake of 90 mmol a day, if I had a banana a day, would that, how much is that? Gives the...
Okay. If you have a very healthy, balanced diet, all right, which includes probably 5 a day or 7 a day, which includes even your one banana, whatever, how much ever, that should be sufficient. All right? So, at the moment, high blood pressure in this country is managed by prevention and treatment. Treatment is not where we are aiming. Our aim is only to prevent it. All right? So, as I said, whilst prevention is to strike at the root of the cause of this blood pressure, at the risk factors, we learned the risk factors, and then we just have to eliminate those risk factors if possible. As I said, by exercise, weight loss, low fat, low salt, high fiber, and diet. There is something called as the DASH diet. How many of you have heard about DASH diet? D-A-S-H dash. Diet. So DASH diet is a dietary advice to stop hypertension. There are different levels of DASH diet. If you're high blood pressure, the DASH diet is different. So probably you can go and find out after Sabbath about this DASH diet in case you want to kind of follow them, and they'll recommend what to eat, what not to eat, and things like that. The specifics of that. So I was just thinking the public will be here, so I just said, I've just put the slides. Whatever I've said has to be bombarded again and again and again. Not only to the patients, even for my own self, I've found out that, after a while I keep forgetting. I should not be, sedentary. I need to walk, I need to do these things. So even to me, after all, I also am a patient. When it comes to that, we are all human beings. We are all having the same environment and same sort of work, and nobody is exempt. And this education, a patient, anybody can be a patient, including a doctor, isn't it? So this patient education is very much so. If you are one, or if your family member is one, keep bombarding this information and again and again and again and again and again. There is no harm in telling them these things. Because I'm not going to, I thought in case anybody from the public are going to ask these things, there are different type of medications, works in different ways. I'm not going to go into those things. Main thing is, it is a silent killer. It is highly prevalent. There are these risk factors. To prevent it, we need to eliminate these risk factors in those 7 rules that I mentioned. So that's a very, very simplistic way of putting it regarding prevention of high blood pressure. Do you have any questions? If you don't have, thank you for listening. But I am not done yet because the cholesterol is there. I do not know whether you have time for that or not. Okay, any questions now or comments that you want to tell me?
I suffer from hypertension and have medication, but my doctor told me that he treats black people different. They have different medication to white people. Is that true?
I do have another presentation which I didn't intend to present it here. I think I do have it here. I mean, it's not because they are biased or anything like that, but black people and the people of Afro-Caribbean and Caribbean origin have a higher tendency for stroke. So therefore, they have to be treated a little bit more aggressively. So therefore, 3/4, I just wanted to give you the accurate information. 3/4, just a minute, please. The Asian people are treated for diabetic in the same way how they treat the Afro-Caribbean people for high blood pressure, because Asians are 6 times more prone to have the complications of, sorry, I don't know why this is stuck. Probably I wanted to show you one slide, but it's not here. I'll tell it to you. So, as I said, people of the Afro-Caribbean origin or the African or Caribbean origin have threefold more risk of developing stroke, heart attack. So that is the reason they'll have to be treated differently than Caucasians. That's number one. So that's for high blood pressure. Similarly, Asians, 6 times more likely to develop complications as a result of diabetes, than the rest of the population in the United Kingdom. So the Asians will be treated differently for diabetics, not because they are biased, but because of the studies, genetic studies have shown of greater propensity, genetic propensity for them because of probably their diet, because of the environment, and because of the other risk factors that has had an impact on the very genetics that they have. And that is the reason you're right. That's the reason they do that. And we do that as well. Why we do that is simply because of the various presentations. And similarly, there are other diseases that the Caucasians are more prone to, and they will be treated differently than the others. For example, there are certain diseases that we don't find in the tropics, that is only prevalent here in the European countries as well as in the West. So that you won't see in the other things. For example, melanoma. Just giving an example of melanoma. It's different. All right. So, have I answered your question, sister? Okay.
Do you think have more of an effect on whether or not you will develop, whether it's high blood pressure, whether it's diabetes, out of all of the factors that you said? Because for me, I really believe that a lot of it has to do with our dietary intake. That's what I personally believe. Even genetic, even environment, even if you add everything, if you try, and I'm not talking like I do, but I'm just saying, if you try to eat as raw and organic as possible, it does cut out a lot of these things that you're putting in your body that cause us to produce these illnesses. That's what I personally believe.
If you are asking me the single most factor that determines it is, I would say, it is the lifestyle, because this is basically a lifestyle disease. I mean, a diet, yes, but Yes, diet has changed, but the lifestyle, for example, I might eat good food, but if I just am sedentary and don't do anything, so that good food can become a poison in my system as well. So yes, perhaps diet will come second in my opinion. This is my personal opinion, but I would think it is the lifestyle. Then I'm going to come to that in the next slide. Shall we go to the next one? That will be a very, very short presentation. Very short presentation on cholesterol because, okay. So, cholesterol. So, what is raised cholesterol? You know, when you check the blood, cholesterol has different components. I'm not going to go into the details of that. There is very broadly, if you have to classify, you know, they are classified as low density, very low density, and high density. Now, the reason why I wanted to mention is because one is good cholesterol, the other one is not good cholesterol. So I want to tell you what is good. The high density cholesterol is good, whereas the low density and very low density is not good. Just because it is low, we think, oh, it is good. But just think, the high density is good. In saturated fat, you have a lot of low density. That's the reason it is dangerous. So in what was the food I was mentioning? In processed food, there is high amount of low density cholesterol, which is bad cholesterol. But when it doesn't matter whether high density or low density, irrespective of high or low, if the cholesterol level is more than 5 millimole per liter, then you know your cholesterol levels are high. But don't get me wrong, this is kind of a very broad aspect, but you know, there are different categorizations of the people. I don't want to go into I have a slide, probably you'll know what I meant. You know, there is high risk, there is medium risk, there is low risk, there is severe risk, there is very severe high risk. So in all these aspects, in all these different, you know, categories of people, the level is different. So, but generally, I'm just putting it on a very, very broad base that if it is more than 5, it is raised. So just check whenever you're checking, just look at the figures, see if it is more than 5. Then you need to, if it is more than 5, you know, you need to kind of pay attention to it. Now, as I said, around 30% people out there are having high blood pressure, adults. Now, what about cholesterol? There is raised cholesterol, around close to 60% of the people will have raised cholesterol. 30% have raised high blood pressure. How many? Almost double will have raised cholesterol. So if there are 10 people here in this hall, 6. That includes me too. So, and it's around, and the women have slightly a higher preponderance for raised cholesterol. All right, I'm not going to go into the details. Let me just. I do not know whether I should go to the American College of Cardiology and American Heart Association. They have recommended, I'm just put it, these are the things that they have recommended for cholesterol kind of management. Healthy lifestyle, and you need to reduce the low density lipoproteins, LDL, right, which is the as I said, the bad cholesterol levels. I don't want to go into those details. If you want, I can just share the slides for the numbers. And as I was mentioning to you, you were asking, did you ask about that? Who asked me about it? About the different levels of cholesterol. I mean, the 5 millimoles, as I said, you broadly classify as patients with diabetes, patient without diabetes, patient with heart disease, patient without heart disease. And then, for every category, you treat it differently. So it's little bit more, it gets more complex when it comes to treatment. But as I said, I'm not worried here about the treatment. I'm here only about the prevention. So cholesterol, basically, it is fat. If I have to just say it in very simple terms, it is fat. Oil, isn't it? Minimize oil, fat intake. We eat a lot of high amount of cheese. Cheese has what? Salt as well, isn't it? Salt and fat together as well. So very dangerous. So when you have all these things, when you have this high amount of fat, especially saturated fat, then of course that is what causes these deposits. What happens to this fat? It goes, as I said, as I showed in the picture here. You can see that's the heart. The heart is supplied by blood vessels. Why you do this? They say that, I've got a stent, I have to do angioplasty and all those things. What happens? The blood vessels that supply blood to the heart, the fat, cholesterol, it deposits in the wall. And you can see that in the picture. Can you see that? In the extreme, to your extreme right. So it kind of clogs, the fat deposit it deposits on the wall and clogs it. So what they do, in order to open it, they put a balloon, and the balloon dilates it, and then they put a stent. That's the reason it's called as a balloon angioplasty. Have you heard about this? Balloon angioplasty. The balloon goes and dilates, and then they put a stent. You can do it through the blood vessel here, from the artery in the hand, or from the femoral artery here. You can insert it all the way into the heart. So that's what it does. So these fat goes and deposits on the blood lining of the blood vessels, causes it, narrows it. Now, how do you reduce it? How do you prevent it? Preventing is don't feed it, isn't it? Don't reduce the fat intake. As simple as that. I can't simplify it more simpler than that. Then, of course, similar things like what I said for that, exercise. Now, how do you prevent fat absorption? When you take a high fiber diet, the fiber diet will prevent fat absorption. So, to reduce the cholesterol intake, if you take high fiber diet, it will reduce the fat absorption. But fat also is required, is necessary. Why I'm saying this is, there are 7 vitamins, out of which A, D, E, and K, 4 of them, require fat to get absorbed. So if you do not have oil or fat, these 4 vitamins cannot get absorbed. Because they are fat soluble vitamins, A, D, E, and K. So that is very important. A is important for the eyes, D for calcium and bones, E, for the cell integrity, blood vessels integrity, and all for aging, and K, that is for blood clotting and things like that. All these things will get deranged if you do not have enough fat. So just have enough oil, but have the other oil, which is the Holy Spirit, in excess, but not this one.
But I also think that, with the whole fat business, there's so many different sources of where you can get fat from. So, I'm not saying to everybody go and eat an avocado a day. You know, I love avocados. I know that it's got good fats, but I also know you can't eat too much avocado as well. So you got the fat from the avocado, you got fat from dairy products, you got fat from poultry products as well. There's so many different areas of fats that you can absorb. It just depends on what you use as your source of fat.
I agree with you, sister. Yes, I agree with you. Is there anything else that anybody else wants to comment or say? Thank you so much for all your contribution.
Carbohydrates, when taken into excess, is also stored as fat. Is that correct? Yes. Whether it's sugars or just starchy food, eventually that turns into fat.
Glad you asked this question. There is a process that happens that sugar can be converted into fat deposits, and fat can be broken down into sugar as well. Now, I didn't touch upon diabetes here today. How diabetes happens is when fat breaks down, it can get converted into excess sugar. On the contrary, when you have excess of sugar, that can also get deposited as fat as well. So both ways it is possible. I'm glad you raised this point. So you can get fat through all the other resources, including sugar.
Just wanted to find out if somebody who has high blood pressure, can it be reversed, like if you go on plant-based diet?
Okay. I can answer these questions in two ways. If I have to answer as a professional, I would say hypertension is an irreversible disease. Sorry, not an irreversible. It is not you can't cure it. Okay? You can only I will explain it in a different way so that I don't like to say that because it offends me as well when I say that. It is a myth that they say hypertension can be. Once it happens, you can't escape that. So that is the reason. What happens is people think it is irreversible, it can be cured, and what happens is they take the medication, and when the blood pressure comes down, they stop it, thinking that it is cured. Because once you're on it for what can happen is you can modify it and reduce it. For example, all these things that I mentioned earlier, to modify the risk factors, I said it can reduce it by 5 millimeters, it can reduce by 20 millimeters, it can reduce it, but it is not going to totally eliminate and make it normal. Okay? Because the very fact that this has happened is because there is some risk factors. You modify your lifestyle and the risk factors so that your blood pressure remains normal. Okay, so you're not going to say that I'm hypertension free. You can just say my high blood pressure is under control. Diabetes, if it is a pre-diabetes, you can reverse it. If you are a pre-diabetic, you can reverse it. But in terms of hypertension, you can modify the risk factors and maintain optimum normal level and even live a normal life. Did I make sense? Did I make it clear?
I'm not very clear. So I'm trying to understand, because for me, is it like once you've been given the diagnosis of high blood pressure, are you saying that diagnosis now will remain? Yes, you can modify your lifestyle, yes, you can modify your eating habits, everything, and you can get to your baseline of very good blood pressure. But because you've been diagnosed with that, this will now remain with you for the rest of your life. Now you're just maintaining it. Because for me, I have different idea about, that, basically.
As I said, that's the reason it is a misconception or a myth that it can be reversed. Because I'm just, I want to be very upfront to the profession that I'm involved. And I won't be saying this to my patients, because if I say that, they'll stop the medications, and the consequences are catastrophic, including death. So I wouldn't stop my medication, or I might, for example, if I need, as I said in these pictures, as I put, there are okay, there are different classes and different groups of medications. It affects the blood, it affects in different mechanisms. So I might be taking 3 medications for high blood pressure, or 4 medications for blood pressure. I'm just giving an example. So if I modify these risk factors and make lifestyle changes, I might reduce my medications from 4 to 2, or 2 to 1, or 3 to 2, depending on every individual. So every individual is different. There's no one same. That's the uniqueness of God's creation too. Every individual responds also to the medications differently. So I can reduce, but I cannot totally eliminate.
The medication.
I have to say that. If I was not a professional, I might not say that. So I have a professional duty too. Okay? So I wouldn't say yes.
So just to confirm, so with your doctor's hat on, you're saying that irrespective of your lifestyle changes, irrespective of, you consuming the better foods to get rid of the fat in the cells, everything, yeah? Irrespective of you doing that for years, let's say you started today with 10 years and you reduce your 4 high blood pressure tablets down to 1 after maybe 5 years, you as the doctor hat in you is saying that you're not going to advise your patient to stop taking that 1 blood pressure loss.
Exactly.
That's with the doctor hat on, yeah?
Yes.
Don't laugh to your
Can you take off the doctor hat? It's just so that...
Yeah. The thing is, because I don't want anybody to get a wrong impression and anything happening to anybody here. I need to be very careful. So that is the reason I have to be very careful what I say. Every sentence can be life or death. So everything I'll have to titrate my answers to all the questions. So what we are telling here is preventing high blood pressure. You're ending up with high blood pressure. If you do all these things, you can prevent completely. You won't even take medications. I'm not talking here about those who are already having high blood pressure. You can't prevent. You're already there. When you already have it, how can you prevent it? You can only reduce it.
A lot of our congregation may, like based on our ethnic minority, based on our culture, how we live, may already have, whether it's high blood pressure, whether it's diabetes, may already have that. But I do understand what you're saying is prevention is always going to be better than cure.
Yes.
However, we speak to the people.
This is very specific about preventing even before you had it. But if you have it, I've not gone into that. If you have it, you modify your lifestyle so that it is managed at an optimum level so that you don't develop the risks of high blood pressure like stroke, heart attack, kidney damage, and things like that. So that is what I'm saying here. If you already have it, you can't prevent it. You have to manage it by modifying your lifestyle. Okay? But as I said, diabetes is a different subject altogether. If you are a pre-diabetic, you can reverse it.
Can you reverse type 2 diabetes?
Type 2. I'm not talking about type 1. Type 2 pre-diabetic, you can reverse it. But if you are already a diagnosed or insulin-dependent diabetic, that of course is not reversible. That is only manageable.
Yeah.
Did you have a question? What was your question?
Is high intensity exercise good for your heart if you've got like hypertension or high blood pressure?
Yeah. If you have a high blood pressure or raised cholesterol, high intensity or cardio exercise is very, very dangerous. If I have to just tell it plainly, yes. Because what happens is, when you involve in high intensity exercises, the need for oxygen to the heart to pump the blood increases. Now, if it is already narrowed or thinned out or blocked, you're not going to get that. And as a result of that, the spasm happens. And when that spasm happens, that's what is called as heart attack. The rest of the heart muscle lacks oxygenation and dies. Heart attack is simply because lack of oxygenation to the heart muscle, and the muscle undergoes infarction, which means is death as a result of lack of oxygenation and blood supply.
Okay. Dr. Paul, thank you very much for coming here today. Did we enjoy that? Was it educational in some parts? Yes. I mean, obviously we know some stuff and other bits. So again, thank you very much for coming, enlightening us a bit more about cholesterol and how to prevent, really important, how to prevent. If you don't have it, don't get it, absolutely. They say prevention is better than cure. So, 2 things I need to say to you before we close. You've been handing a form. I would be very grateful if you filled it in before you left and handed it back to either myself or Annette.
Also get the subject.
Yeah.
Like I said, it's a silent killer. You don't
It's very
true.
How often? For cholesterol, for blood pressure, would you suggest that?
Blood pressure, you have to check it. Blood pressure. So you need to check it.
Sorry, I got one.
About high blood pressure. High blood pressure, you'll have to check it standing as well as resting or sitting or lying down, and then see if there's a difference between the postural differences, lying down and sitting, standing, if there's anything. And if you feel faint, don't faint, just make sure that slowly you get up and then check it. There's a difference between lying down and standing. You need to immediately report to your GP, and they'll have to do the monitoring and things like that, 24-hour monitoring and the whole monitoring. They might have to do that. You will have to check it. If it is normal, then you can check it every few months. But if it is not, then depending on how high it is, then if it is very high, you'll have to check it more frequently. And then monitoring at home is always better, simply because you don't have the stress and strain. People who have white coat syndrome, like me, it'll be fine when I check it in my house. But when I go to the hospital,
It's high.
and they tie that cuff here, I can just see just going all the way into my head. So the white coat syndrome, sometimes it can be there, and it can be detrimental, and it can give you wrong readings as well. So that's about the high blood pressure. Regarding cholesterol, depending on your age, okay? After 40, of course, they do yearly, all right? And of course, after 60, they increase the frequency as well. So that depends on the age, and depends also on the results of your initial test. Then, of course, if it is raised, then they'll ask you to repeat it after 6 weeks or a couple of months, like that. So that all depends. Every individual is different, and depending on the value too.
After we close here today, so last time we were here, we talked about, we had a really good program about health, 8 laws of health, and we provided a snack next door, which included sweet biscuits and sweet drink, and we just thought, oh, what are we doing? So today we have none of that. You'd be pleased, and some people might be disappointed to hear. We have some fruits and then other healthier foods. So we ask, if you feel like a snack, just come and join and take some of the refreshments of the healthier style. And that's it for today. We thank you again for coming. If I can ask us all to stand.
Let us pray. Loving Heavenly Father, you are interested in our health, and we know, dear Heavenly Father, you care because our body is the temple of the Holy Spirit. And therefore, Lord, you have given us this temple to care for it. And everything that we do to this temple reflects of how good a steward we are to the task that you have assigned. Help us, Lord, that we will not destroy this temple, because the Bible says those who destroy it, him will God destroy. And help us to care for it, and help us to be responsible individuals, because when you ask the account from us as stewards, that we will be able to give a good account. Forgive us where we have failed for whatever reason, because of ignorance or because of all the other things that has, Lord, taken us unawares. But I pray that from here on, help us to be conscious, help us to be healthy, and help us to practice these laws